fellow nurses and healthcare enthusiasts. Welcome back to All About Nursing. In today's video, we are diving into the world of nursing tips to staying organized during a nursing shift. Nursing can be challenging, but with the right organizational tools and strategies, you can thrive. Let's jump into our 10 tips. Number 1, prioritize your tasks. Make sure you are prioritizing care. Do what is most important first. Then we do the less important things that need less attention at time. For example, make sure patient's ABC, it comes into play. Airway, breathing, and circulation. So if you are managing patients, you have to decide who you go to first. You assess your patients based on their needs and the immediate attention that is required. So pain management doesn't surpass airway problems, okay? Point number 2, use your nursing brain sheet. Your brain sheet is what helps you to be able to manage and prioritize your care. The brain sheet is where we take down all the information, the vital information, patient details, the medications, scheduled procedures and stuff. This is a fantastic tool to scheduling and managing yourself so that you know where everything is and what has to happen. Do cluster care. Manage your patients in clusters. For example, when you go to a patient's room to administer medication, and you have your nursing assistant completed your vital signs, you are to go in there and do your head-to-toe assessment, administer your medication, and do your PPs. Make sure your patient have 4 Ps of daily rounding. So there you have it. I have clustered my administration of medication, my assessment of my patient, and ensure that my patient is comfortable. While we are doing all these things, we are educating the patient as well. So I have accomplished 4 things in going into this patient's room in administration of medication process. Number 4, what we can do is stay ahead of time. Try to manage your time. You are there for 12 hours. You know what you have to do. Do not wait last minute to get things done. If you have a patient scheduled for an appointment at 10 a.m., get that patient ready when you go in to ensure that they have all what they need. So when you're going to give medication at, let's say, 8:30 a.m., you're giving morning meds, you ask the patient, let me see your ID band. Have you had a bath? Are you ready to go to your appointment at 10 a.m.? Do you need me to get you anything before you go? You do all of that. That will help you be able to be ahead of time. Number 5, keep your station clean and tidy. Keep your workspace nice and tidy so it will contribute to you not being overwhelmed. Having a tidy workplace, you can find your tools quickly. You'll be able to get things done. You'll be able to focus and not feel like, oh my God, everything is just coming at me. When you have the desk all messed up and everything just bundled up and everything just all over, you won't be able to organize yourself. Number 6, utilize technology wisely. So we have things like the Rover machines. That's the cell phone that they use in the hospital to serve medications. We have the Pyxis. The Pyxis is a great help. You can go into the Pyxis, plug your patients list in, so you only see your patients, and you can check their medications. It shows the time, it shows what's due on the Pyxis. You can use your electronic charting. You can chart on any computer, anywhere in the patient's room, on the Rover, on your Mac. You use all these things to help you. Don't be documenting and double documenting. Manage and use your electronic equipment around you. Have an effect. Number 7, have effective handoff. Effective handoff means you go to the point. You say, what is the patient's name? What is the situation? Why are they here? What we are doing for them? How do we plan to get it done? How far in the care we are? I don't need to know about the fluff of the family drama or whatever jokes the patient was cracking on all these things. We need to stick to that so we can manage time. Because when we do fluffing handovers, we tend to drag it out. So the nurse is like lost. By the time you're done, you're tired because it's like, it takes so long just listening to this long story. You lost half of the information. Just get to the point, straight and effective, okay? Number 8, delegate appropriately. You are one person. You cannot do every single thing. That is why there's a team. There's a team made up for that. So we have bloods to be done. The phlebotomist can do that. We have the patient need to have some water delivered to their room. The nursing assistant can do that. Blood transfusion, that's the RN. We do that. So you don't delegate that, okay? So what you do is you manage the patient care and you delegate the task appropriately to the people that are licensed to do so, okay? Number 9, Take short breaks. Short mental breaks is very important. You need to phase out just for a little bit. So if you need to go to the bathroom and walk and wash your hands and wash your face, or just to take a moment to just look at yourself and calm down, you do that. And please take your lunch breaks. Some nurses, we tend to think we don't need to take our lunch breaks. We do. We are people too. Go to the bathroom and empty your bladder. Go to the side, go walk away for 5 minutes. Get your brain together and go again. It helps. If you do that every 3 hours, 5 minutes, you give yourself 5 minutes, just for your mind to calm down, you will feel refreshed. Just to calm yourself and go again. And point number 10, reflect and learn. Finally, take time to reflect on your shift. Consider what worked well, what did not work well, and make adjustments for the other shift. So you always improve. Do self-assessment. Say, what did I do that made me lose time? Did I stay too long talking about stuff that wasn't important with my colleagues? Did I take too long with taking out my medication? I didn't plan myself properly to take out my meds, so I had to be triple checking it to see where the medication is. Did I not manage myself properly with regards to managing my patients, prioritizing their care? These things, all these 10 points, we apply to ourselves to ensure that we can have a great shift. So we can manage the chaos that is our shift that we daily deal with and be able to finish on time. So remember, guys, we are here to learn to improve ourselves, improve our care that we provide. Don't forget to like, share, and subscribe for more nursing content. And don't forget, nurses do it better. Ciao.